Welcome back to Dr. Grandpa, your trusted health tips, Grandpa's wisdom. Today, I'm going to reveal the uncomfortable truth most doctors don't fully explain. Heart attacks don't always come from junk food or laziness. They often come from hidden risks silently growing for years, even in people who believe they're doing everything right. If you or someone you love thinks I'm healthy, this won't happen to me. This video could save a life. Most people define health by appearance, thin body, active lifestyle, or normal lab reports. But real cardiovascular health goes far deeper than what we see in the mirror. Many heart attacks occur in people who look healthy because dangerous processes are happening silently inside their arteries. Health is not just what you do, it's what your body is quietly enduring over time. Heart disease rarely announces itself early. Arteries can narrow slowly over decades without pain or warning signs. By the time symptoms appear, damage may already be severe. This silence is exactly why heart attacks often seem sudden and shocking, especially in people who believed they were healthy. Many people trust routine tests like cholesterol or blood pressure alone, but these numbers don't show inflammation, plaque, stability, or arterial damage. A normal report can create false reassurance while dangerous plaque quietly builds within the heart's blood vessels. Being slim does not guarantee heart safety. Visceral fat surrounding internal organs can exist even in thin individuals. This type of fat releases inflammatory chemicals that damage blood vessels and increase heart attack risk. Regardless of outward appearance, exercise is powerful, but it's not armor. Some people exercise regularly yet still have heart attacks because exercise cannot erase poor sleep, chronic stress, inflammation, or genetic risk. Movement helps, but it must work alongside deeper metabolic balance. Family history plays a major role. If heart disease runs in your family, your arteries may age faster even with good habits. Genetics influence cholesterol handling, inflammation, and clotting behavior, often without obvious symptoms until a crisis occurs. Chronic stress raises cortisol and adrenaline, which damage blood vessels over time. Even calm-looking, successful individuals may live in constant internal stress. The heart responds to emotional pressure just as strongly as physical strain. Inflammation weakens arterial walls and makes plaque unstable. A heart attack often happens not from blockage alone, but when inflamed plaque suddenly ruptures, forming a deadly clot. Inflammation is rarely tested, yet critically important. You don't need diabetes to damage your heart. Repeated blood sugar spikes common after refined carbs injure arteries, even in people with normal fasting glucose. This hidden damage accumulates quietly over years. Heart attacks in healthy-looking people are not random. They are predictable when we understand the deeper causes. In this video, we will uncover every hidden fact trend, more importantly, how to protect yourself before it's too late. For decades, people were taught that high cholesterol automatically causes heart attacks and low cholesterol means safety. This oversimplified idea has harmed more people than it helped. Cholesterol itself is not the villain, it's how it behaves. Oxidizes and interacts with inflammation that truly determines risk. Total cholesterol combines several different particles into one number. Two people can have the same total cholesterol, yet one has stable arteries while the other is near a heart attack. This number hides critical differences in particle size, inflammation, and arterial damage. LDL cholesterol has been labeled bad, but that label is misleading. Large, fluffy LDL particles are relatively harmless. Small, dense LDL particles penetrate artery walls easily and trigger plaque buildup. Standard blood tests rarely show this difference. LDL becomes dangerous only when it is oxidized, damaged by inflammation, smoking, poor diet, or stress. Oxidized LDL triggers immune attacks inside arteries, accelerating plaque formation. This process happens silently and is rarely tested. HDL is called good cholesterol, but higher is not always better. Dysfunctional HDL loses its protective role and may even contribute to inflammation. What matters is HDL function, not just its level in a lab report. Statins lower cholesterol numbers, but they do not fully address inflammation, insulin resistance, or plaque stability. Some people on statins still experience heart attacks because the root causes remain untreated. Medication without lifestyle correction is incomplete protection. High triglycerides often signal insulin resistance and metabolic trouble. Even with normal cholesterol, elevated triglycerides dramatically increase heart attack risk. This marker reflects how your body handles sugar and refined carbohydrates. Heart disease is primarily an inflammatory condition. Without inflammation, cholesterol cannot easily stick to artery walls. But when inflammation is present, even moderate cholesterol becomes dangerous. This is why stress, sleep, and diet matter more than numbers alone. Most lab ranges are based on population averages, not optimal health. If everyone is metabolically unhealthy, normal becomes misleading. Many heart attacks occur in people whose numbers fell within these outdated reference ranges. Advanced markers like insulin resistance, inflammation levels, triglyceride to HDL ratio, and arterial imaging predict heart attacks far better than cholesterol alone. Prevention begins when we stop chasing numbers and start understanding the whole system. Sleep is when the heart repairs itself. Chronic lack of sleep raises blood pressure, disrupts hormones, increases inflammation, and damages arteries. Many healthy people sacrifice sleep without realizing they are weakening their heart every single night. Ongoing stress keeps cortisol and adrenaline elevated, forcing the heart to work harder around the clock. Even calm-looking individuals may live in constant internal pressure. Over time, stress stiffens arteries and increases the risk of sudden heart attacks. Many foods labeled healthy whole grain bread, fruit juice, granola, smoothie scones, sharp blood sugar spikes. These spikes damage artery walls, promote inflammation, and silently increase heart risk even in non-diabetic. You can have normal blood sugar and still be insulin resistant. This hidden condition forces the heart to work harder and accelerates plaque buildup. Many heart attacks occur in people who never knew their metabolism was under stress. Low-fat and diet foods often contain refined carbohydrates, seed oils, and additives that inflame arteries. Removing fat but adding chemicals creates metabolic chaos that silently increases heart attack risk. 1 hour of exercise cannot undo 10 hours of sitting. Long sedentary periods, slow circulation, increased clotting risk, and impaired blood vessel function even in people who work out regularly. Unexpressed emotions, grief, anger, anxiety affect the heart physically. Emotional stress triggers inflammatory responses and irregular heart rhythms. The heart listens to what the mind hides. Moderate alcohol is often considered heart-friendly, but regular drinking raises blood pressure, disrupts sleep, and promotes arrhythmia. In many people, alcohol quietly increases heart attack risk. Air pollution, plastics, pesticides, and household chemicals trigger inflammation and oxidative stress. These invisible toxins damage blood vessels and accelerate heart disease even in those with healthy lifestyles. Heart attacks don't happen overnight. They grow from small daily habits ignored for years. Awareness is power, and prevention begins when we identify what silently harms the heart every day. Most doctors rely on basic panels like cholesterol, blood pressure, and fasting glucose. These tests detect late-stage problems but miss early arterial damage. Heart disease often develops years before these numbers become abnormal. Inflammation is the engine behind heart disease, yet markers like hsCRP are often ignored. Without measuring inflammation, doctors miss the underlying fire that destabilizes plaques and triggers sudden heart attacks. A heart attack often occurs when a small, unstable plaque ruptures, not when an artery is severely blocked. Standard tests focus on blockage size but ignore plaque stability, which is far more dangerous. Advanced imaging like coronary calcium scans can reveal early plaque buildup long before symptoms appear. Yet many patients never receive these scans until after a heart event, missing years of preventive opportunity. Single blood pressure readings don't show daily fluctuations or nighttime spikes. Many people have normal readings in clinics, but dangerous elevations during sleep or stress silently damaging their arteries. Doctors often wait for diabetes to diagnose metabolic damage, but insulin resistance harms arteries years before blood sugar rises. This delay allows silent damage to progress unchecked. Medical guidelines are based on population averages, not individual biology. What's safe for one person may be dangerous for another. Personalized risk is often ignored until a crisis occurs. Fatigue, shortness of breath, jaw pain, and indigestion are often dismissed as stress or aging. These subtle symptoms may be early heart warnings that go uninvestigated until it's too late. Modern medicine excels at emergency treatment, but struggles with prevention. Lifestyle counseling, root cause testing, and early intervention often receive less time than prescriptions and procedures. Heart protection improves when patients ask deeper questions, request advanced testing, and address lifestyle roots. Empowered patients detect risks early before a heart attack becomes the first warning. Persistent fatigue that doesn't match your activity level is one of the most common early heart warnings. When the heart struggles to pump efficiently, the body compensates by draining energy, reserves often mistaken for aging or stress. Feeling breathless while climbing stairs, walking short distances, or talking may signal reduced blood flow to the lungs. Many people ignore this sign until it suddenly worsens during a cardiac event. Heart-related chest sensations aren't always sharp pain. Pressure, tightness, fullness, or burning, especially during exertion, are often dismissed as indigestion or muscle strain, allowing danger to go unaddressed. Heart signals often travel along nerve pathways, causing discomfort in the jaw, neck, shoulders, or upper back. This referred pain confuses many people and delays critical medical attention. Nausea, bloating, heartburn, or stomach pressure, especially after activity, can be. The heart and digestive systems share nerve networks, making cardiac distress feel like digestive trouble. Waking up short of breath, sweating at night, or experiencing unexplained anxiety during sleep can indicate nighttime blood pressure spikes or heart. Rhythm disturbances, critical warnings many people ignore. When the heart can't maintain steady blood flow to the brain, dizziness and lightheadedness occur. These episodes are often blamed on dehydration or fatigue, but may signal underlying heart weakness. Women often experience subtler heart symptoms, fatigue, nausea, anxiety, or back pain rather than classic chest pain. This leads to delayed diagnosis and higher risk of sudden heart attacks. If activities that once felt easy suddenly feel exhausting, your heart may be struggling to meet demand. This gradual decline is often ignored until a serious cardiac event forces attention. Heart attacks rarely come without warning. They come when early signs are ignored, misunderstood, or normalized. Listening to your body and acting early can prevent irreversible damage. True heart protection is not about chasing perfect cholesterol or blood pressure numbers. It's about reducing inflammation, stabilizing plaque, improving blood vessel flexibility, and supporting metabolic health. When these foundations are strong, numbers naturally improve. Ask your doctor about advanced markers SCRP for inflammation, triglyceride to HDL ratio, fasting, insulin, coronary calcium scans, and blood pressure monitoring over 24 hours. These reveal hidden risks years before a heart attack. Heart protective eating focuses on whole foods, healthy fats, fiber, and stable blood sugar, not extreme restriction. Ultra-processed foods inflame arteries, while real foods help arteries heal and remain flexible. Preventing blood sugar spikes protects arteries, nerves, and the heart. Balanced meals, protein, fiber, and movement after eating reduce silent damage even in people with normal blood sugar. Daily movement matters more than intense workouts alone. Walking, light resistance, stretching, and breaking up. Sitting time, keep blood flowing, and reduce clot risk. The heart loves consistency. Quality sleep repairs arteries, balances hormones, and lowers blood pressure. Poor sleep quietly raises heart attack risk. Protecting sleep is not optional, it's essential heart medicine. Managing stress protects the heart as much as diet and exercise. Breathing, prayer, meditation, social connection, and emotional expression lower inflammation and stabilize heart rhythm. Medications may reduce risk for some people, but they work best when combined with lifestyle correction. Pills don't replace sleep, movement, nutrition, or stress control, they support them. Your heart is unique. Family history, lifestyle, stress, and metabolism all matter. Work with your doctor, ask better questions, and build a plan that addresses your specific risks before symptoms appear. Looking healthy does not guarantee heart safety, but understanding your heart does. Prevention is not fear, it's wisdom. Take care of your heart today so it can take care of you tomorrow